I'd like to welcome once again all our participants for this webinar about our newly released MTR capsule studies. I'm very excited about that new topic. This is a new topic for Klein. The team has been working very hard for months to get to the results we'll be presenting you today, and I must say that we're very happy with the outcome of that study, and I hope that today's presentation will give you a taste of what we've been able to achieve in that area. So as the previous slide was showing, we'll have 4 parts in this presentation. I'll be taking you through the first 2 parts. One would be an introduction to Klein & Company for those of you who are not familiar with us. The second part will be a bit more focused on what is our MTR capsule study and what we've been covering. And then I'll turn it over to Ekta, who will be presenting you some of the key findings of that study, first for 2019 and 2020, and then she'll go through some of our forecast model for this study. So let me start with Klein & Company. So Klein & Company is a market research and a management consulting company, global company. The type of services that we offer fall into 3 groups, basically. We are publishing syndicated market research reports and databases in various areas, and notably in the specialty chemical areas where both Ekta and myself are coming from. Then we do, to cover topics that we are not covering from our off-the-shelf reports, we do have a custom research department. And finally, we also have a team of management consultants that are working on more strategic topics that are linked to, for instance, M&A advisory or go-to-market strategies. I was mentioning that the company is global, and that's you can see our global footprint on this slide with 10 locations globally, located, for instance, with 4 offices in Asia, Shanghai, Tokyo, Delhi, and Hyderabad, 3 offices in Europe, Brussels, London, and Prague, and the company is headquartered in the USA, Parsippany, New Jersey, more specifically. So a global footprint, which is very important when we cover those global markets, as this is the case with the MTR capsule studies, because we can do the research locally. So Klein provides, and that I'll be very quick about that, an extensive series of global syndicated research studies. I'll be a bit more specific about what we're doing in the pharma, chemicals, or nutritional area in a few seconds. The company also have a global team that's well known within the industry. This is very important, notably regarding the methodologies that we're using to do our studies. We are focused and committed to some of the industries we are covering, so we're not offering market research reports about everything and anything, and specialty chemicals, for instance, is an area that Klein has been active in for 60 years now. The last 2 points are coming from the structure of our company. We have the ability to leverage consulting assignments on the top of the markets we are covering, and we're publishing reports and databases, and we have access to a global network of industry experts. I was mentioning our methodology. That's quite important, and so to give you an understanding of how we come to the results that you can find in our studies and that Ekta will be presenting you today. So we have at Klein a very specific and a very strong focus on primary research that makes us very different from any of our competitors. So primary research basically means conducting interviews at various points of the value chain, be it within the case of empty hard capsules, it is with suppliers, manufacturers, distributors, but also with end users, with governmental agency, trade organizations, for instance. So these the focus on primary research. Most of our information is coming on primary research, and it's very important when it comes to those B2B markets where no data is available, really. So this is where that focus on primary research that helps us getting results covering markets in a level of details that is not matched in the industry. Of course, we do also use secondary research as a source of information, but really what makes us different is our focus on primary research. Yes, Ekta, you can go to the next slide. Thank you. And so I'm now slowly but surely getting to the topic of today's interest. And before I go more in details about our study on empty hard capsules, I want to explain you a bit of the history and what took us toward the empty hard capsules study. And actually, this is a new study for us, but it's a long time that we have been working in the pharmaceutical ingredient or pharmaceutical chemicals area. You can see on this slide some of the key studies we are regularly publishing in the area. Notably, one that's probably our most important or largest in the field that covers oral solid dose excipients both in the pharma area, but also in the nutraceutical area. So those are two studies that are published. We're covering, and we have published parenteral excipients for parenteral dosage form, for topical dosage form too. Lately, and also a study on nutraceutical active ingredients. So you can see that we have this area well covered. Just a last word to two studies that are coming very soon that we're preparing for later this year. One's about biologics, excipients, and ingredients, in which we are looking at the entire value chain created by the growth of biologic drugs. And finally, we are also preparing a study about solubility enhancement excipients, or excipients that are using to enhance the solubility of our active pharmaceutical ingredients. So this is in mostly oral solid dosage forms, but also in parenteral. So that was for the introduction to a bit of our pharma portfolio, if I can call it that way. Now, more specifically on the empty hard capsule study. So the empty hard capsule study that we just finished, you can switch to the next slides, please, Ekta, is a study that has base year, two base years actually, 2019 and 2020. This is very important because it gives us an understanding of a pre-COVID situation, so 2019, and what happened to the market with COVID, so 2020, with forecast up to 2025. This is a global study, so we have access to a global database, but that has been put together by working on 9 countries very specifically. And building the countries you can see are obviously the 4 key markets that are China, India, Europe, and USA. And we also cover Brazil, Pakistan, and 3 countries in Southeast Asia with Vietnam, Indonesia, and Thailand. So those are the 9 key countries. And then we have rest of the world that gives the overall global view. So this study that's not published, as I said, is coming as 2 key deliverables, database that I'll be discussing in a second, and reports that I will also be describing you quickly. So the database, I think the database we have at Klein, we use to publish databases for quite some time now, and notably in the pharma chemicals area. And our databases are usually working as online pivot tables. What makes those databases interesting, and especially the one on empty hard capsules, is the granularity of the data, is the level of detail that we are able to provide. And to give you an idea, I'm having on this slide a few of the attributes that our data can be split by or filtered by. So it's, for instance, it is sector. So sector meaning Are we looking at pharma versus nutraceuticals or nutritional supplements? And even within pharma, we're splitting out branded RX, generic RX, OTC products, and then the supplements area are split in between multinational and local suppliers. So that's one way to split information. Then we're also looking obviously at the polymers, the base polymer for the capsule. Mostly we're looking at gelatin, obviously, HPMC with or without gelling agents, Pululan, and some others. We are also looking at splitting the volume and value data by functionality. So that means instant release versus modified release, dry powder inhalation, or clinical capsules. Customer type, that's CMO or non-CMO, and finally, suppliers. Ekta will show you some examples of what does it mean, what type of data can be extracted from that. But what I want to mention is that those filters or those attributes can be combined. So for instance, if you look at the data for US, you can say, okay, I want to see the data for RX branded products, gelatin-based capsules, instant release from supplier X, and the database will give you a volume and value information for this. So that was for the database. The database is one part of the offering, and I think a very important part. But it is obviously coming with a set of reports. There's one report per region, one report per country, so 9 reports, and then a global summary. And what I'm presenting here is really the outline of those reports. So very quickly, because I don't think this is relatively self-explanatory. We're looking some of the key information that you'll find in the reports are an overview of the regulation, an understanding, a description of the pharma and the supplements market in the region, and then we'll be focusing on on the consumption figures. So how many MTR capsules are consumed in a given country. What's very important when we speak about consumption is that we're speaking about consumption of empty capsules. So if a capsule is filled in India and then that capsule is actually used by a consumer in USA, for us, this is a consumption that happened in India, because this is a study that has been put together, notably for supplier of people that want to understand the market potential for empty capsules. So last, I think, point here from me about those deliverables, 2 snapshots. So you can see on the top right corner, that's one of page of one of our report. So it's relatively straightforward. But then on the bottom, you can see a screenshot of our database. So you can see here that our database work as an expand collapse kind of system, and you can see that all the source of the info, all the attributes that can be used here. So region, country, sector, supplier, etc., etc. So I guess that's my last slide. I will now turn it to Ekta to speak more about the market and the key findings. And we'll be glad to answer any question at the end of the presentation if there's any. Ekta, up to you.
Thank you for the introduction, Nicolas. And once again, I welcome you all to this webinar presentation. I will be taking you through to the 2 remaining parts of this presentation, where I will present some key facts and figures on the market of empty hard capsules globally, with focus on the impact of COVID-19 on this market. And then we will see the market outlook and forecast for this market. So let us first start by looking at the global picture of oral solid dosage market. As of 2020, this market is estimated to be approximately around 2.8 trillion units. As we can see from the picture here, globally, tablets dominate the major share in the global oral solid market of pharmaceutical and nutraceuticals combined, with almost 55% share. This is followed by hard capsules, soft gels, and all other oral solid dosage forms. As we all know, tablets are cost-effective and easy to manufacture, and therefore, formulators are attracted to use this dosage form for the formulation in both the sectors. However, the share of tablets is slightly more in the nutrition sector as compared to the pharmaceutical sector. This is simply because of the higher popularity and acceptability of newer dosage forms like hard capsules, soft gels, gummies, pellets, and powders in the nutrition sector. Hard capsules, although used much less compared to tablets, are the second preferred dosage type, used in both sectors again. Low friction properties of capsules make them easy to swallow and therefore ensures patient compliance. However, the higher cost of manufacturing of these capsules than tablets makes their penetration low. Soft gels are a relatively newer dosage form in both nutraceutical and pharmaceutical sector, and they have currently limited application due to their high price. Like hard capsules, these dosage forms are also more prominently seen in the nutrition sector, where they are used mainly for oily and liquid nutraceutical actives. The other dosage forms that we see in oral solid sector are powders, pellets, gummies, and pastes. So now let us see how the COVID-19 has made empty hard capsules an increasingly interesting market in 2020. So among all the type of dosage forms that are used in pharmaceutical and nutraceutical sectors, oral solid dosage has the biggest share, simply because they are cost effective, they are easy to produce, and also promote patient compliance. Pre-COVID, the use of nutraceuticals was already being seen as a way to maintain good health, especially in the developing countries. The need was rising because of the aging population and also with increasing chances of chronic diseases. The COVID-19 further aided to this trend by bringing a shift in consumers' consciousness. A surge in the demand for dietary supplements was seen as a way to maintain overall health and well-being during the pandemic. And so because most nutraceutical products are formulated as oral solids, the rise in the production of this dosage form was also observed in 2020. The nutrition sector is more accepting of hard capsule as a dosage form, simply considering the benefits that it offers, such as easy scalability, availability in wide colors, sizes, functionalities, and also the offering of vegetarian capsules, which is very unique to this dosage form. Hence, the growth in the supplement market has really aided the growth of empty hard capsules to a great extent during this pandemic period. Interesting changes were also seen in the market of empty hard capsules in 2020 in different regional markets. For example, the pharmaceutical market of empty hard capsules was observed to decline or slow down in the Western markets, while it surged in India in 2020. Similarly, in the nutraceutical side, all country markets witnessed growth in the demand of these products, but the nutraceutical market in Pakistan followed a downward trajectory. Distinct effects of these changes were also seen on the different capsule suppliers. For example, the suppliers which were more focused on the pharmaceutical sector showed no or less growth in 2020 as compared to the suppliers who shifted their focus on the nutraceutical sector were actually benefited from the situation. Hence, empty hard capsules becomes an important market and opportunity for the suppliers. And we shall discuss about these changes and these effects a little bit more in detail in the coming slides. Now, this takes us to the market analysis of empty hard capsules in the nutraceutical and pharmaceutical sector. The overall empty hard capsule market was estimated at around 742 billion units as of 2020 and valued at around $2.1 billion. As you can see from the chart that pharmaceutical is the larger consumer of these capsules as compared to non-pharmaceutical or nutrition sector. This is simply because nutrition industry is a much younger industry as compared to pharmaceuticals, and in many developing country market, it is still in its infancy. So overall, the market of empty hard capsules saw a significant growth in 2020 globally. The growth was mainly driven by the increased demand for dietary supplements, especially the immunity enhancement supplements like vitamins, minerals, and probiotics. On the other hand, in the pharmaceutical sector, growth suffered. The COVID-19 public health response in the form of lockdowns and social distancing measures really led to far fewer patients' visits to health facilities. Most people avoided going to these facilities amid the fear of catching a COVID infection. Hospitals were also emphasized to reduce the number of patients visiting or hospitalized patients. Many non-urgent medical procedures and treatments were put on hold, which combinedly or in combination had a serious negative impact on the demand of prescription drugs in the pharmaceutical sector. And this overall, in turn, impacted the demand for empty hard capsules in the sector. Now, let us see the split of consumptions of empty hard capsule across different countries or regions globally. As you can see from the chart, China is the leading consumer of empty hard capsules, followed by India, Europe, and the United States. These four key regions account for roughly 3/4 of the total demand of hard capsules. Overall, all country markets witnessed growth in the demand of these capsules in 2020, but exception to this was the markets of China and Pakistan. In China, more than 80% of the demand of empty hard capsules is in the pharmaceutical sector. So despite the fact that the demand for these capsules grew in the nutrition segment, it was not enough to offset the decline that was caused in the pharmaceutical sector due to reduced patients' visits to hospitals, as well as the restrictions that were put on the retail sales of certain drugs like antibiotics and medicines for colds and flu in China. In Pakistan as well, the demand declined in both the sectors. So if we talk about these two sectors separately, in the pharmaceutical sector, all country markets witnessed growth for these capsules as saw a decline in the demand for these capsules as the production of finished products reduced in 2020, except in India and Vietnam. So India is the largest exporter of generics medicine globally. Although the country struggled a lot during the 1.5 month long lockdown, But once the lockdown was lifted, the industry really pushed to produce generic drugs to meet the domestic as well as the export demand. Similarly, Vietnam saw the least impact of the pandemic as there was no strict lockdown for more than 2 weeks in the country. If we look at the nutraceutical sector, again, all country markets witnessed growth, with the exception of Pakistan. So unlike Western countries, consumer in Pakistan lack awareness towards the health supplements and mainly rely on the advice of medical practitioners to buy these products. Since the health facilities were temporarily closed during the lockdown period, the demand for these nutraceutical products also reduced in the country, which negatively impacted the consumption of empty hard capsules in the sector. Another interesting trend that can be seen in this market is the business model of compounding pharmacies, which is very unique and specific to Brazil. So these pharmacies offer individualized formulations where the formulation is prepared in the guidance of a qualified professional, but are customized to an individual patient. So these pharmacies actually act as a way to offer personalized medicines at much affordable prices to consumers. Now, this was about the consumption of empty hard capsules. And now if we look at the supply side of the market, we will find it rather consolidated. The top 10 suppliers account for roughly or more than 70% of the total demand of empty hard capsules. As you can see from the chart, Lonza is the leading consumer, followed by ACG, Anuhi, GS Capsules, and Suhong. Lonza has strong presence across many key markets of empty hard capsules, such as China, Europe, the US, and Southeast Asia. The company has maintained its dominating position due to its superior product quality, wide product portfolio, and service offerings like like capsule customization and regulatory and formulation compatibility support to its customers, among others. If we look at this all other portion in the chart, it includes many suppliers for which the sales have been covered in our study in detail. Now, if we look at the manufacturing footprint, Asia accounts for more than 3/4 of the total production of empty hard capsules, with most major suppliers having their production facilities in the region like ACG, Anuhi, GS Capsules, Suhong, and Lonza. Now let us look at the supplier landscape across 4 key regions of this market, which is China, India, US, and Europe. So in China, the country is really struggling with the overcapacity situation for empty hard capsules, with utilization lower than 60%. Although the major chunk of the market is covered by large suppliers, there are many small-scale local producers in the country. In India, ACG dominates the market and captures almost half of the market, while the rest of the supply is fragmented between various foreign and local suppliers. In more developed markets like US and Europe, the empty hard capsule market is mainly consolidated, but increasingly seeing the penetration of Asian suppliers. Most hard capsule suppliers witnessed growth in 2020 when compared to 2019. However, the growth differed for each suppliers based on the type of sector that they were catering to, and also it differed because of the product performance of their customers. So, for example, the suppliers who were catering to the nutraceutical sectors performed better than the suppliers who were mainly catering to the pharmaceutical companies. From this slide, I will be able to explain you further the complexity of the competitive landscape with an example, and how it varies within each country market and each sector as well. This slide also shows, as Nicola mentioned earlier, the level of details that is covered in our database and report. So here I'm taking an example of the non-pharmaceutical sector in the market of empty hard capsule market of Thailand. So on the left side, you'll see that the two sectors are listed in terms of their volume sizes. And within this, if you look at the non-pharmaceutical sector, there are two polymers that are mainly used, gelatin and HPMC. You'll see a larger share for the gelatin polymers because it is being traditionally used in the market and is also more cost effective as compared to the HPMC. HPMC is the second polymer used, and I am further zooming into the market of HPMC to show you how it is used across various functionalities like instant release and modified release. And further into the market of modified release to understand its supplier scenario. So here we can see that the market of modified release is mainly captured by three suppliers, that is Suhong, ACT, and Lonza. One thing though to note here is that each country market has a unique mix by polymer, segments, and supplier. And at the same time, each sector has also specific mixes. For example, the non-pharmaceutical sector in Thailand do not use pullulan as a polymer raw material, but the pharmaceutical sector does. Similarly, for the simplicity reason, HPMC here is combining both types, that is with gelling agent and without gelling agent. But they are well split out in our database and report. Further, the use of capsules for dry powder inhalation and clinical use is not seen in the non-pharmaceutical sector, but these are very important functionalities in the pharma sector. So these nitty-gritties and details are well captured in our database and report. So having looked at the market fundamentals, now let us discuss the commercial aspect of it especially in regards to the pricing. So the prices of raw materials directly impacts the prices of empty hard capsules. For example, the vegetarian capsules based on HPMC and pullulan are priced higher as compared to gelatin-based capsules. The main value proposition of vegetarian capsules is that they satisfies the need of vegetarian and vegan consumer. And the real value proposition is their plant origin, which satisfies the need of a vegetarian and vegan consumer, and also ensures the halal status of the product, which is a very important aspect in some country markets which are dominated by Muslim population. We further studied the different pricing strategy of different polymers, of different suppliers in depth, and observed that the same supplier uses different price strategy for the same product in different country markets to be competitive. We also observed that the prices of these empty hard capsules not only vary by polymer and suppliers, but also in many country markets, they vary by the sectors and functionalities that they are used in. So I will now move on to our next topic, which is the impact of COVID-19 on the market of empty hard capsules in 2020. The 2020 has been a very unprecedented year, and the COVID-19 pandemic really led to a strong public health response, which resulted into countrywide lockdowns and social distancing measures, which all took their toll on the consumer markets of empty hard capsules. So to really study the impact of the pandemic on these hard capsules, we studied these two consumer markets, that is pharmaceutical and nutraceutical, to understand this impact. And the most important and prominent impact was that we all saw was the disruption of global pharmaceutical supply chain, which really caused the shortage of some APIs in the first half of 2020, especially in the country markets, which really depended on imports of raw materials. And also, this shortage led to a delay in the production of certain drugs. Amid the pandemic, the prices of polymer raw materials also increased in certain country markets. For example, also increased in certain markets, for example, in India, where capsule manufacturers really struggled to procure the raw material supply in the first quarter of 2020, when the country was under lockdown and most facilities were shut. We have well discussed already the demand drop of prescription drugs, which was seen globally due to less hospital visitation by the patients. On the other hand, the demand grew for the OTC products in some country markets like US, Europe, and Indonesia, where patients prefer to self-medicate rather than going to hospitals. Rise in the demand or increase in the demand for dietary supplements was another prominent impact that was seen worldwide. But what really, aided to the growth of this nutraceutical segment was the fact that how easily the nutraceuticals were available to the masses through different channels, such as convenience stores, supermarkets, and also through online channels. Capsule production slowdown and stocking of capsules were more specifically seen in the India market, where the lack of manpower and delay in the raw material supply really caused a lower, really led to a lower efficiency of capsule manufacturers in the first quarter of 2020. Additionally, some formulators which really struggled to procure the supply of raw materials bought more than regular volumes of empty hard capsules in the second and third quarter, and also, bought large volumes in the last quarter of the year. In some country markets where the demand drop for prescription drugs was seen drastic, especially in Thailand and Indonesia, manufacturers or formulators were left with a high inventory of, or the excess of empty hard capsules inventory in the first and second quarter, which led to purchase hold and also the cancellation of some orders in third quarter. So I'm reaching towards the final part of this presentation, and I will discuss here some of the factors, the various factors that are driving the growth of empty hard capsules going forward. So what are these factors on which the growth of empty hard capsules is based on? So let us first examine the drivers. I will discuss some of the main few first. The healthcare sector is really has been a center of the COVID-19 pandemic, and the need for healthcare spending is expected to continue in the forecast, continue to grow in the forecast period. There is increased number of generic drugs that are expected to enter in the market and are the key focus for many generic pharmaceutical markets like India and Pakistan. More than 50 drugs are expected to come off patent until at least until 2022. So this will give an opportunity to anti-heart capsules to grow in the generic segment. Growth in the pharmaceutical and nutraceutical industries will also be the drivers for anti-heart capsules, as the consumer shift in the consumer consciousness towards the use of health supplements is expected to boost the demand for nutraceuticals. Clean label trend is becoming increasingly prevalent, especially in the Western markets, where the consumer demand for ingredient traceability and elimination of additives has really set a stage for this movement, this clean label movement. This trend is more in favor of the capsules, as it is the only dosage form that complies to this trend, with its offering of vegetarian capsules based on HPMC and Pololan. Now, let's look at some of the main restraints that we see for the market. The major restraint, which is, or the major deterrent which is seen for the growth of these capsules, is the competition from the alternate oral solid dosage forms. So tablets offer the main competition, or they are mainly preferred over hard capsules in both pharmaceutical and non-pharmaceutical sectors, simply because of their cost effectiveness. Additionally, in the nutrition sector, capsules also face competition from other dosage forms like soft gels and powders. Again, the competition is also increasing from alternate non-oral solid dosage form that, for example, the growing success of biopharmaceuticals, which is really translating into, lower or lesser entry of chemical drugs into the commercialized market. The other deterrents that are there in the market is the increasing cost of raw material prices, especially colorants, pigments, dyes, printing inks, which has increased in 2020 due to supply disruption, and is not expected to come to the 2019 level anytime soon. Rather, we might see a gradual increase in with time in these raw material prices with annual inflation. So, therefore, the effect or the combination of these drivers and restraints is with the combination of these drivers and restraints, the market of empty heart capsules is expected to grow at an average annual rate of 4.7% in the forecast period. Each regional market is set to follow unique growth trends. From the picture, it might appear as if Pakistan is the leading market for, or leading growth market for empty heart capsules, but in reality, it is not the case. So Pakistan's growth outlook is really influenced by the sharp decline that both of its consumer sectors, that is pharmaceutical and nutraceutical, saw a decline in 2020. So we expect the market to return to pre-COVID level in 2021, and then to follow a pre-COVID growth trajectory going forward. So in reality, India is the fastest growing market for empty heart capsules in the forecast period. The growth is mainly driven by India's stronghold in the export market of generic drugs, and strong demand from its domestic market itself. In the US and Europe, the higher consumer awareness towards nutraceutical is something that will drive the demand of empty hard capsules in the nutrition sector. And this will also make up for the market slowdown that may be seen in the pharmaceutical sector because of its greater dependability or dependence on the imports of raw materials. Vietnam is expected to be the slowest growing market for empty hard capsules, simply because of the lower preference towards capsule as a dosage form, and especially in the growing sector of nutraceuticals. So the concept of preventive healthcare is very new to Vietnam, and consumers do not like to see their health supplements in the form of typical pharmaceutical dosage form, which is a real deterrent to the uptake of empty hard or hard capsule dosage form in Vietnam. So what is driving this growth of 4.7% in of 7% for empty hard capsules? The fastest growing consumer sector for empty hard capsules is going to be supplements. It was already a growing segment, and the pandemic has kind of reinforced the need for health supplements, especially immunity boosters like vitamins and omega-3s, which are formulated as hard capsules. In the pharmaceutical segment, it is the prescription generics which will grow the fastest. Simply, as we discussed earlier also, that there are many drugs which are expected to come off patent in the forecast period, which will favor the production of generics. And also, it is driven by the low-cost healthcare initiatives that many governments are undertaking to make pharmaceutical drugs more affordable for the consumers. So this will also favor the production of generics. The growth in the OTC segment will be mainly supported by the self-medication trend that is growing. But on the other hand, RX branded would really face a tough competition from the other dosage forms in terms of innovation focus, such as parenteral and biologics. So with this, we come to the end of this presentation, and I hope you all found it useful and enjoyed it. Over to you, Vera.
Thank you, Ekta. That was a really extensive presentation. Thank you so much. There were several questions during the this presentation, and Nicole actually was able to answer them directly to the person asking. They were more related to the way we actually gain information about suppliers and the pricing information. So I don't think it would be interesting for everybody. There is one more outstanding question. We don't have much time left right now to cover everything. But if you can connect with Nicola directly, you can see his information on the slide in front of you, or there will also be an email coming to you directly from webinars@clientgroup.com. You can always ask in return. There's a response to that email. I'm hiding behind that email, so we can help you that way. So I think, there was actually one more general question from another anonymous audience person. I should actually hide the anonymous people, but if you can, Ekta, help answer that question. What are the key customer considerations when they are evaluating their supply options? Is that something you can cover?
Yeah, sure. So these considerations actually really vary with not only the end use market, but also vary with the different geographies. So for example, in the pharmaceutical consumer segment, the focus is really on the quality, as this market is highly regulated, and people don't want to really, formulators don't want to really compromise with the quality of their product to have any issues in their approval process. This is also, this can be well understood through one more trend which we observed in this market, that most pharmaceutical formulators procured the anti-hard capsules directly from the suppliers, while there are options available through e-commerce websites as well. But that is not the trend we observe for pharmaceutical formulators. Another thing that varies with the geographies is, in some markets, it is very important to have a halal status or halal certified product, especially the markets which are dominated by Muslim populations, such as Pakistan and Indonesia. While it was not the case where there were no, regional religious preferences. Besides the points, there are price. We really saw that quality and this halal status was something that formulators were specifically asking for or looking at when they were choosing a supplier.
Very interesting. Thank you so much. I hope it was helpful for everybody at attending our webinar today.
Yeah,
So Nicola, you have a really bad sound.
Great presentation. And what I wanted to ask, maybe if you can just click one more time, so all contact details will be on your slide.
Nicola, I have to stop you because the sound is really bad. I don't know what happened on your side. We cannot hear you very well. So yeah. So anyway, I guess we're getting very close to the end of our hours. So if maybe you can do a follow-up, or I can do a follow-up. You can tell me what it was about. So thank you very much for the presentation, and we hope you connect with us if you need anything about to learn more about the study, and if you have any further questions. So be happy to help. We're here to help. Thank you so much, and goodbye.